instead of working with all the 50 at once, you can pick few, like 5 or 10. Start implementing whatever you said is your solution. So the one that I said, you start small and maybe you start on a smaller scale, and then now you can proceed to a larger scale once you have seen that you tested it and it's possible, it's working for you. So when doing, you do it on a small scale as you check so that you can proceed to the larger scale. So you do and you continuously check, keep on checking, rechecking, see whether you are on track, whether you are achieving your desired result, whether you are on course, like are you actually achieving what you wanted to achieve, or do you like see that there are other issues have come up as you are implementing your solution, or do you like need to add or remove things from whatever you have said that is what is your solutions. So checking helps you in knowing whether you are on track or not on track, whether you need to add or subtract anything from your identified solutions. So acting now means whatever has worked for you, whatever has you have seen that is actually yielding fruits. Now you do what you implement it on a larger scale now. For instance, I said you start with like few CHPs, 10 CHPs, that when you have actually worked with them, like maybe you give them like token that whoever brings mother for delivery, you are given something. So this may be motivated even the others. So you see like the more people they bring, the more token they will get. So you see that this is actually working for you. This means that you are supposed to add the remaining 40. You said you start with 10. Your target was 50, but you started with 10. So if you had seen that this 10 actually is yielding results or whatever you had intended, so you now bring on board the remaining 40. So how is it anchored the PDSA cycle, the CQI on the PDSA cycle? We have the 7 steps of Kaizen. That is step number 1, 2, 3, and 4, which is theme selection under step 1, situational analysis under step 2, root cause analysis under step 3, and identification of countermeasures under step 4. All these are under planning. You remember I said when you plan, you identify your gaps, you identify your issues, and at the same time, you identify solutions to these issues. So you can see from step 1 to 4, we have identified our issues. We have actually understood what are our contributing factors in step 2. Then step 3, what are the reasons as to why, where we are and not where we are supposed to be. And then step 4, now what are we going to do about our issue? So all these are under planning. As you plan, you identify your issue and come up with solutions. Then when doing now, implementing under Kaizen step number 5, you go ahead and implement whatever you have identified as your countermeasures. Just as in PDSA cycle where you now implement, but on smaller scale, not at once, not at larger scale from the beginning. You test it. So you start small and grow bigger. Then check. Check now under Kaizen step is step 6 and 7, where you check effectiveness. As I said earlier, you keep on checking whether you are on track, whether you are achieving your desired result, or you have deviated, or you need to add something, or you need to reduce something. So these are all under checking effectiveness. Then whatever has worked for you is now what you are going to standardize. And standardization means that you are going to make part of your culture of your organization. It becomes a culture for your organization or for your department, for your section, for your facility. And then under ACT for the PDSA cycle is now, I said PDSA is a continuous cycle. So you keep on repeating. You don't stop there that you have reached your target and now you relax. No, you keep on doing, redoing over and over again. So it's not something that you say, I've achieved, now we are at 80% of, we are at 80 deliveries, and that's what we wanted to reach. And we are now, okay, now we can relax. No, you keep on moving every now and then. So how do you do your Kaizen theme selection? You sit as team, you brainstorm. Remember, when brainstorming, you don't discuss. You allow everybody to share their ideas, but also not everybody should be bringing up what he thinks is challenge in his department or her department, or in if you are doing for a facility, maybe in that particular facility. So you give opportunity everyone. You can even maybe do it like as you give small paper to everyone, so everybody can list the issues that they think affect their service delivery. And remember, whatever you are listing down is not something outside the scope of your work. You are listing things that affect your indicators. If it is about delivery, if it's about immunization, if it's about, basically it's about service delivery within your facility, looking at the various indicators that you work with. So what are the gaps? So you list issues based on that. Then after you have done that, now you can discuss, come together and now categorize. We said you have two levels of Kaizen. That is a small Kaizen and large Kaizen. Once you have listed all the issues, maybe you say like there's low skill delivery, there is low TB screening, there is long waiting time for patients, there is, named it, all those issues. I've just given a few examples. So after you have listed all this, now you come and categorize, you ask yourself, is this something that you can be able to do immediately? Does it require time? Are we going to finish it within a week, a month, or several months? Is this something that we ask all those questions so that we can categorize in small Kaizen or large Kaizen? So for the small Kaizen, we said it's like a puzzle, we just put together and you are done. Maybe like an example is maybe your office space, your office where you work. Things are, there's so much clutter, things are, you cannot even pick anything if you want to pick because of the way the place is organized. So this is something that can take you like a day or two. You just move your table from maybe where it is, you create space, you move what you don't need from that office so that you can be productive. You can easily pick whatever you want to pick and use it and then return it. You can see, pick and return. So you don't waste time looking for whatever you want to use. So that is small Kaizen. Now for the large Kaizen, it's now the things that you are going to subject to matrix diagram for feasibility check. You move with it to the next step. So the theme selection itself, as I said earlier, we have 7 steps of Kaizen. That is theme selection, which we are doing today. Then situational analysis, which is step 2. This actually tells us, why are you saying you have an issue? Why are you saying you have a gap? You are saying you have low skill delivery because you are supposed to be at 80 and you are at 20. You have analyzed your situation. That is the baseline data you need to collect so that you can actually measure your achievement. You are at 20, you implemented Kaizen. How far have you achieved them? How much have you achieved? So you cannot say you have an issue, and if maybe somebody tells you, you have low skill delivery. Our facility actually we have low skill delivery. So justify why are you saying it's low? That is now step number 2. Then step number 3, the root causes. You are asking yourself, why are we having low skill delivery? The reasons as to why you have low skill delivery. Then step number 4 is, what are we going to do about this low skill delivery? As I said earlier, you can just an example. You think maybe working with TBS, working with maybe CHPs, maybe working with or improving services, like maybe even giving something for the mothers after delivery. All these are countermeasures that you think once you bring them to your facility, they can improve your low skill delivery. So whatever you have identified as your countermeasures, now you go ahead and do what? And implement. If it is about working with TBS, call them, work with them. If it's about working with CHPs, you have to call them, work with them. If it's about maybe improving services in your maternity, in your facility, maybe you want to connect with these mothers, you provide warm water, you provide all these things that what you thought are going to work for you. So you have identified, so you go ahead and implement all of the countermeasures that are identified as your solutions. So as you're implementing now, you keep on checking. You said you will be working with TBS. How do you see after you have maybe brought them on board, you started working with them, is there any change? And the deliveries increased. You said you'll be giving mothers maybe basins, towels, giving them warm shower. Has it actually increased your deliveries? You keep on checking now. Whatever has worked for you is now what you are going to make it a culture in your facility. You now standardize. If it is maybe the issue of working with TBS, now you always work with TBS. In facility X, We work with T-based, maybe you can even have monthly, quarterly meetings with them, or if it's about giving mothers goodies like basins and maybe treating them well, that is now the culture of that institution or that facility. So what is Kaizen theme? Kaizen theme can be defined as a problem which should be identified and solved by the work improvement team for improvement of work processes, services, content, safety, or resource management to meet client satisfaction. So basically, it's just improving on identified gaps with an aim of meeting the client's needs or satisfying your clients, because bottom line is client satisfaction. You want to make your clients happy so that they can come back again and again to your facility. So you are improving on whatever you are improving so that you can meet the client needs. That is basically what is Kaizen. So why do we need to select Kaizen team? As I said earlier, we have so much issues in our departments, in our facilities, and we cannot solve all of them at once. So we need to prioritize so that we can pick on which is the most important thing for us. One Taichi Uino, the former vice president of Toyota Motors, said having no problem is the biggest problem of all. You will all agree with me. We all have issues. We all have gaps. We all have challenges in our sections, in our departments, in our facilities. So you can also agree with me that not all of us have reached our targets. We all have targets in different indicators, in different programs. Not all of us are at 100% or the percentage that we are supposed to be. So we all have issues. There are challenges that have made us not to reach where we are. So who can identify select Kaizen team and select Kaizen team? It's work improvement team. Who are this work improvement team? It's us. It's me and you. It's whoever is working in a particular department. Maybe TB department, maybe maternity, MCH department, maybe facility X. We are the work improvement team. We are the people who know actually what is hindering us from achieving what we want to achieve. We are the people who know why we are not doing well in TB, why we are not doing well in maybe HIV or PMTCT or all those indicators that we usually work with in our facilities. So we are the right people who can select Kaizen team. It's not the sub-county to come and select for us Kaizen team, or it's not the county to come and tell us your issue is this, work on it. So it's us actually to know what is not working in our, where are we now in terms of maybe particular indicator. It's us. So we are the right people to select Kaizen team. And with this work improvement team, these are people who have issues that are similar, who work in a particular department, who share or who have a common challenge. Maybe you say like, you can even have a merge of with like maternity with maybe MCH with, because their work is almost similar. We can sit down together and discuss or brainstorm on our issues that we can tackle as team or as group. So we have steps of selecting Kaizen. So step number one, as I said earlier, we brainstorm. We come together and brainstorm. What do we brainstorm on? We brainstorm on processes, flow of work within the department or section. How do we work? How is our flow of work? We can brainstorm on such area. Safety of the staff and patient in the department. Maybe we have issues with safety of our patients or even us as staff. This is just a guide, like what do we brainstorm on? If anything that affects or anything that is an issue within our department, looking at what we do, looking at our routine work. Why are we in facility X? Why are we in department X? So those are the things that you're supposed to brainstorm on. Remember, you are not supposed to brainstorm on things that are beyond your control. These are things such as working hours, because you cannot change the working hours. You cannot say from next week, or we want to work on the issue that instead of coming 7:45 or 7:30, we'll be coming at 9. That one you cannot, because it is not within your control. You cannot also talk about human resource that we need to employ more staffs. We need clinicians, nurses, lab tech. No, you cannot, because those are beyond your control. So you pick on things that are within your control, the things that you know that you can work on them, you can improve on them.